Thank you for hitting play, and welcome to the series we're calling Data Pioneers. We're bringing together the brightest minds in the healthcare industry, supporting the transition to value-based care. We'll be highlighting the best practices, tools, lessons, and advice with a focus on data and analytics. I'm your host, Rich Waller from WellStack, and we're very excited to have you join us today. All right. Welcome to a special edition of Data Pioneers. Today we have Asif Shah Mohammed, partner at ECG. Asif, welcome to Data Pioneers.
Thank you, Rich, for having me here today.
Yeah, super excited. It's always awesome to connect. We've had so many great conversations over the last year or so about things going on in the industry. And as I mentioned today, this is a special episode because we're going to feature a recently announced partnership called the Cypher Collective, which ECG has put together, and the team there has been fantastic. We're going to get into that super deep today. But first off, Asif, maybe just as way of background, give us a little bit background about yourself. Some of your background, how you got into the healthcare industry.
Yeah. So as you mentioned, I'm a partner at ECG Management Consultants. We're a national healthcare consulting firm where I lead our digital innovation practice. I've been at the firm about 18 years, and throughout my career here, I've focused on helping our clients effectively navigate the operational and strategic implications and the implementable reality of healthcare technologies. So much of my work in the last few years has been facilitating the development of actionable recommendations on how do you prioritize digital health investments to be able to compete, to differentiate, and develop innovative business models to ideally elevate the patient experience, drive operational and clinical excellence. Our work is now increasingly focusing on helping our clients sift through the alphabet soup, if you will, of AI jargon. So I'm very excited to have this conversation about how to use this rapidly evolving technology enabler to solve for some of the most prevalent challenges that I think you and I, we've been in this for a long time now. We've been dealing with this throughout our entire careers. Things like your workforce shortages, the physician burnout, improving patient access, reducing the cost of care. And ultimately, this is where I think, WellStack really comes in, is how do you start to use that vast trove of data that health systems are sitting on as a strategic asset.
Yeah, absolutely. And you come from a electrical engineering background, right? So you can bring that engineering background to the table. Tell us a little bit about kind of like that career progression, how you got through that, and what you kind of bring to the table from that experience.
Great question. And um, I was in electrical engineering undergrad. Somehow, healthcare found me, and I ended up working for a hospital system in my first job after college. And this was back in the late 1990s, and the hospital I went to work for, it was just starting to transition and start to build a technology infrastructure. They were still moving from punch cards to modernizing their medical record systems, deploying PACS, other healthcare IT capabilities, which 25 years later, all of this has become so ubiquitous. But when I look back on this, I got a front seat view very early on in my career. And you can call it a greenfield opportunity for implementing a gamut of systems without a lot of legacy infrastructure, which was great, helpful, right? And for me, as a 20 something with an engineering background, adopting new technology was fun. For me, it was really easy. I could intuitively fly through using almost any new system. But then, as I started supporting all these new platforms that were getting deployed across these hospitals, quickly realized that unless a new technology or functionality is seamless, it's easy to use, it actually improves someone's workflow, you'll quickly run into resistance. You can deploy a Ferrari, but if users are not properly trained, and while people are generally forgiving to a point, ultimately it needs to work in a frictionless manner. And my CIO at the time recognized this, and he made it our IT department's mission, our imperative, that we clearly understand that hospital end users, the nurses, the clinical staff, the physicians, other frontline staff, they demand technology that just worked, right? And they have other demanding jobs, and the technology was supposed to be an enabler to support their work. But typically, there's a handful of folks who complain. Many people just live with the problem. It is our jobs as technology leaders to really ensure that we're just not focusing on that squeaky wheel, the person who, you know, asks for things the most, but we're taking that big picture view to really address issues more globally. And this is a lesson that I've taken in throughout my career since. Simplify our stakeholders' lives so that clients can focus on their core mission, which is taking care of their patients every day.
Absolutely. That's awesome. And we actually come from very similar backgrounds. I was an engineering undergrad and, had worked in the I would say more broad technology industry for a while and ran into, who would be one of my co-founders, Brian Robertson, who was on the show. And he started talking to me about this whole RCM process
Mhm.
in healthcare. And I thought, how hard can this be? Right. And,
Right.
so here we are 15 years later after that, and we're still rocking and rolling in healthcare and all the different technology problems we're looking to solve. So, definitely awesome, very interesting, and again, kind of come from similar spaces in that regard.
Mhm.
And, it's cool to kind of bring that, but then also see, to your point, how far the industry has come. Right. I mean, it
Right.
really, although we do often kind of talk about healthcare, how we move slow and how there's a lot of things we can adopt, but if you really do look at the last 10, 20 years, it's pretty amazing where we've come. Um, but that's awesome. So, as we think about, jumping in here, the topic of the day, right? I mean, everybody's inboxes, every healthcare leader, especially technical leader, inboxes are full of every type of AI solution on the planet,
Mhm.
right? I mean, solving almost anything with AI. Every company is now an AI company, whether on their website or otherwise. And so, what is right now kind of the true job to be done for health system leaders, and how are you through the Cypher Collective looking at helping these organizations navigate the sea that's out there of all this different messaging?
Yeah. The other day, I was in a roundtable discussion with a few health system leaders on the topic of AI. And someone mentioned that, as technology folks, we sometimes develop some kind of tech and then try to solve or search for a problem. And first and foremost, the job of health systems isn't to adopt AI for the sake of AI. It is to really identify if it can actually lead to accountable transformation. AI is a tool, it's not a strategy. So, health systems leaders, they really need to define the why before the what. Clarify the strategic imperatives, frame AI as a means to an end. AI is not the end in and of itself. And for boards, they're demanding to see scalable pilots that ultimately yield results, right? So any initiative needs to be designed to integrate seamlessly into workflows. We need to have the data governance, ensure that there is cross-functional execution between IT, clinical operations, finance, analytics, the service lines that an AI use case potentially impacts. The health systems need to invest in AI literacy across the organizations. Equip your frontline teams to understand the impact of AI driven models in the day to day activities. And then we have to build trust in the tools that we're deploying. So, one of the things that we often talk about in healthcare, and you talked about, coming from an RCM background, no money, no mission. Right? There needs to be a well-defined governance and prioritization framework in place to ensure that the impact and the return on investment can be quantified. And this is where I believe the work that we're trying to do with the collective and starting to build some of the strategic partnerships, we hope to be able to showcase those that return on investment and the impact.
And you mentioned a couple of times, one of the things that's most critical is, getting these solutions sort of into the workflow and, really affecting change. I mean, what have you seen as, kind of successful strategy or some of the approaches that we're taking with the collective to really kind of get those, insights or those tools and things into the either the patient experience or the provider experience, to make sure that those outcomes come to fruition.
Yeah, I think first of all, health systems have made these massive investments in their EHR strategies, whether it's Epic, Cerner, or name the EHR. And this is a portfolio management strategy. It's not a binary choice, right? Do I just wait for my EHR vendor to come up with a promised roadmap, or do I invest in some kind of a point solution? And that's really the point of where we're trying to go with this Hyper Collective. It comes back to a health system's internal governance process for prioritizing those AI-driven use cases. The EHR product roadmaps, they often signal when a core infrastructure will support AI cases. For example, take Epic's recent announcement with ambient listening and AI-based scribing. This is like the most uh, the use case that resonates the most for health systems, right? And many health systems have made these investment decisions around third-party ambient listening technology partners. So while the EHR vendor may be ready with the solution, their tools might require workarounds or even custom integrations, or they may not support more robust functionality just out of the box. So, as a health system leader, when making a decision on an EHR only or a EHR first approach, you have to decide. The most successful ones are the ones that decide if a use case is mission critical enough to justify early adoption, or can they wait for a native integration with the EHR. So, one way that we think about this is taking the use case, the related tactical risk, and then deciding on the strategic timing. For example, take prior authorization, right? Relatively low risk from an integration perspective, um, but it can provide immediate and high ROI opportunities. A health system could make the strategic decision to move forward with a third party vendor option. Bottom line is, you could map that use case to some type of a decision matrix, base it on the urgency, the complexity, and the major dependencies. Also, some clients are starting to hedge their bets with dual track pilots, running multiple vendor pilot options in parallel.
Yeah.
They're tracking the EHR vendor roadmap milestones at the same time. And then they're ready to switch when the native platform catches up, right? So, this is another way to avoid vendor lock in and then maximize flexibility.
And do you often recommend that sort of, kind of the right term of kind of running side by side or kind of a bake off of technology to kind of, basically, you know, have different perspectives? Is that something that you often build into the process at ECG?
Yeah, I think given given the prevalence of multiple vendor platforms in the market today, it makes sense to some extent for health systems that have the luxury of putting in the resources for running multiple pilots in parallel. Not every health system has that luxury, right? And this is where the idea of the Decipher Collective really started to germinate, because we said health systems have their core expertise. They have a mission to fulfill. They want to make sure at the end of the day that they are helping to improve they make their staff more efficient, improve the provider experience, improve the patient experience, or make sure that they're able to meet their margins. And you don't have the time to go out and look at vet, you know, 50 different platforms. And so we basically try to bring together a set of vetted technology solutions that address core client problems, health system issues. And we said we will rationalize the the decision making process for you, right? So there where clients are trying to make quick decisions, and we said, our Cypher Collective really helps you to think about how do you prioritize your decision making? How do you make sure that you are bringing in solutions that have proven ROI, that have been implemented in comparable health systems around the country? We will help you get there. And somehow, we've been running into this very frequently. Is whenever there's a technology contract and the word AI comes in, all of a sudden this becomes a whole different contract and a whole different level of scrutiny goes in. So we're also trying to support and make that contracting process easier through a single master services agreement across all of our vendor partners. So that way, health systems have one contract to sign and one place to go to, one marketplace, and ideally, it makes their lives a little easier.
Yeah. That's fantastic, and I think it's absolutely needed. We see that quite often, when procurement starts to really, it gets into a tough spot because you're wanting to move quickly, do pilots, but rightfully so, right? There's a lot of governance that needs to go into the process, and I think that's one of the biggest, value props of the Cypher Collective. Maybe in, kind of for those that aren't super familiar, let's get into some of the details about the collective itself, right? Some of the problems that we're looking to solve. I mean, as you mentioned, WellStack, we're working on being sort of that data foundation, that enabler for the whole process. But maybe some of the AI enabled companies that are in the collective that you're most excited about, that really kind of like help with that patient journey. That's, I think, the foundation for the concept that you've
Mhm.
been ideating on.
Yeah. Well, I'm really excited because we launched this initiative about a month ago, and we went out to the market and looked for a set of strategic partners that aligned with ECG's core capabilities. We're an advisory services firm. We don't develop technology, right? We don't build platforms, but we advise our clients on the best roadmap for or the best technology roadmap. How should they invest in tech solutions, if you will? So we designed the Cypher Collective as a curated partnership, an ecosystem, if you will, that's powered by ECG. The high level vision is to help health system organizations navigate the AI hype, distill the vendor landscape, and it also provides a single marketplace. I hope at some point in the future we can point to the Cypher Collective and say, there's a AI app for that, right? Maybe.
Yeah.
I hope. We'll see. But it's a platform where our clients, if they need assistance with governance models, navigating to the very rapidly evolving regulatory and legal guidance that's needed, and then implementation frameworks to maximize the value of their AI initiatives, right? That's the core idea. And then we support this with vetted best in class technology enabled solutions that ideally brings together and creates this force multiplier that will help to unlock the AI opportunity. So we'll help our clients, navigate the hype and the fragmentation of all of the AI landscape. We'll assess where our clients are on the AI maturity spectrum, and then we develop a governance model to prioritize investments, right? And each of our vendor partners, we selected them, we handpicked many of these partners, and the goal is as we start to grow this, we are going to continue to vet solutions. So clients can trust that these are solutions that are live today at other large health systems and similar comparable organizations. And they address a wide range of key use cases that align with ECG's capabilities, right? This is the way that we can ensure that you're actually optimizing these implementations. And with our collective capabilities, we hope to provide this differentiated go-to-market offering. We can hopefully increase revenue. These are the core objectives. If you think of this as a Venn diagram, wherever we are able to improve margins, enhance the patient experience or the provider and staff experience, those are the solutions that we are looking at right now, right? So if you will indulge me for a minute, let me walk you through a scenario of, with all of the partners that we have in the mix, how the Cypher Collective can support this end-to-end patient journey. So
That'd be great. I'd love it.
imagine AI agents that can guide the patient using the digital triage, recommend the right setting, and then alert a provider to intervene at the right time, populate the EHR with the key information before the patient arrives. So, with the capabilities that we have within the collective, we have the ability for AI to listen across multiple specialties, summarize the data in real time, flag incidental findings, and support the front end and clinical staff to allow them to operate at the top of their license and then minimize all of the low value add work. So our solution partners, they can forecast demand, align staffing, predict supply and inventory shortages, and then we can proactively support revenue cycle management to accelerate collections. So using all of the structured, unstructured data that's synthesized in real time with a solution like WellStack, we can then help to drive population health, contracting. Where do you invest? Your strategy for investing? How do you redesign your service lines? And we do all of this building upon the legacy EHR investments.
Hmm. And I think that's key, right? I mean, the whole strategy is not to, at all, I'd say, compete or duplicate what organizations are getting out of their investments in Epic and Oracle and the other, kind of ambulatory systems
Mhm.
on the non-acute side of the world, but to really augment and surround, supplement, modernize those investments, right?
Yeah.
Fantastic. In terms of uh, what do you see has been missing in the market, right? I mean, if you kind of pivot to saying like, what fight are we picking though, right? I mean, is there a gap in the market that we're going out and saying, hey, we have a perspective, we're thinking about doing this a little bit differently. What gets you excited about some of the maybe some of the more audacious ways we could think about applying or jumping in with this collective?
Yeah. You know, I reflect back on the EHR deployment journey. Much of that was driven by the meaningful use dollars, and at some level, um, investing in the EHR has almost become a Gordian knot for health systems organizations. We've all heard about physician burnout or click fatigue, all this pajama time, taking away the focus from uh, focusing directly on the patient, etc. And for us practitioners in healthcare, it's imperative that we need to get this AI journey right. Uh, we not just enter back into that vicious cycle where leaders lose credibility, clinicians disengage, or patients opt out. And we kind of saw this a couple of years ago. There was this whole hype around digital health, and that's still there. But everyone was like, "What is this?" Right? So AI has a lot of perceived promise, and for clinicians, if they start to perceive opaque algorithms that override clinician judgment, for example, or this can quickly erode trust. For patients, it can potentially result in broken expectations. The promise of AI alleviating patient appointment wait times, or if AI replaces the human touch without thoughtful design. So, and then you've got potentially poorly trained models that can reinforce health disparities, misdiagnose or exclude vulnerable populations. So, or any perceived privacy concerns, data breaches can trigger public backlash and increase regulatory scrutiny, right? So these are all pitfalls that we hope to be able to um, address,
Yeah,
maybe not fall into, hopefully, and then that's really the idea, right? We want to
yeah.
create this seamless, frictionless experience for our health system clients, and ultimately, you know, provide a better patient experience.
Absolutely. And I was you mentioned kind of that the concept of AI and technology. And as a technologist, I'm often guilty of this because I love new technology. I get excited about it. I want to learn about how it works. And you take ambient listening, which is arguably the hottest space in this whole AI kind of, I would say, market in healthcare. And I've talked to so many people about this and how cool it is, and asked about their opinion, their journey. And I was talking to a leader recently, and what was cool about it is I was getting all into the weeds on ambient listening, and he said, well, we're not really buying ambient listening. We're buying reduced physician burnout, right?
Yeah.
Because that's what it's about, right? It's regardless of whether ambient listening works or how well it works or how the process. You mentioned it in the beginning of that. It's physician burnout as a result of how a lot of the EHRs have been implemented and put into the process, and all great intentions, and I think some definite progress. But when a solution like this comes along, I think it's often just continuing to go back to, and I think with all the different layers of that AI enabled patient journey, I think the other thing that you all bring to the table, which I always appreciate, is just that bringing it back to the what are we really solving here, right? It's not
Yeah.
about kind of an AI agent walking you through a scheduling process, or a back end revenue cycle bot predicting denials per se. It's
Mhm.
like what are we really solving from a job to be done or a use case perspective? And I think the more that becomes front and center, the way more adoption you get across the board with the solutions, and then as we kind of continue to grow in the market.
Yeah, and what I would add to that is it's the ROI, right? So take ambient listening as an example. The concept is not new, right? We've been living with Alexa or Siri for what, 10, 15 years now.
Yeah.
Uh, to your point, this isn't about ambient listening. So there are so many other platforms in the market today. How are they all differentiating each other, right? Where is the return on investment? So many of these platforms are looking at, are they able to improve um, coding, denials, etc. Maybe that's one approach, right?
Yeah.
So the physician, the so and then this ultimately the CFOs. That's where the rubber meets the road. You need to make that case to the CFOs that this investment is ultimately going to be worth it.
Absolutely. Yeah. If we kind of pivot a little bit to the human centered aspect of this, or like the human centered design, is something a lot of folks talk about, and I know that we've had conversations as a collective in this regard. What's maybe some examples of where you've seen the intersection of technology or data and care result in sort of a truly human lesson or outcome for the patient.
Yeah, a couple of years ago, I was helping a health system deploy a direct-to-consumer telehealth platform, and we went through a fairly extensive um, selection process, identifying the right technology solution, thinking through all of the workflows, the reimbursement considerations, and then someone highlighted that it might also help to bring in a patient advocate from the community. And it seemed like a really novel concept at the time. I was initially skeptical of this approach, to be fair. Um, and it was really humbling to see how bringing in that actual patient perspective, the patient's voice, ensured that we developed a seamless solution.
Hmm.
So, we create a lot of dashboards. We have all these algorithms, all these workflows, and I've come to the realization, yeah, I don't think this is novel, but I think this is something that we should be grounded in. We should ask, does this make the patient, the clinician, the end user ultimately feel safe? Do they feel supported? And I think that's probably one of the most human lessons that I've learned throughout my career.
That's amazing. Yeah, those the that kind of feedback and direct insight is there's no replacement for it. Totally agree. Um, as we think about the the organizations a lot of these leaders, they're super busy, right? They have no time in their day. They're being asked to, really drive this. What's like the first step you recommend that they take, or where do you recommend that they not do, in terms of getting started here? Because I think that that's often as important, because again, these folks are so busy, they have so much to do, but then they've been tasked now with this. Almost every board or every organization is saying we got to have an AI strategy. So what's the first step to those out there just trying to figure out how to get started?
Yeah, again, it comes down to asking the why. What is it that you're actually trying to solve for? Does it create a prioritization criteria, right? That says these are the strategic imperatives for the organization. Here are the key pain points that we need to make sure we're addressing, and then go about identifying the right use cases and prioritizing those use cases, then find the technology solution that addresses those use cases. And as you're going through that evaluation process, look at look at this from the lens of, is this going to make my workflows more efficient? Is this going to ultimately um, give me ROI, right? So, what I would suggest, especially to a CIO who's got a lot of time constraints, potentially budgetary constraints, very little air cover, don't chase shiny objects. And again, don't go about it alone, right? Try finding allies, build coalitions, be very strategic in your partnerships. It's very easy to fall into that trap of the perfect is the enemy of the good.
Yeah.
So look for those low lift, high impact use cases. And we've been talking about this governance framework, right? Keep it simple. Define the ownership, the prioritization criteria, establish KPIs, document your decisions so that you can go back in with these key guiding principles a year later and say, this is why we chose to do this work, right? And even if you don't have the budget today, um, I think organization can still start learning, build that AI literacy within the organization, map the pain points and prep the organization for what's coming down the road. I
Mhm.
think true leaders who are going to succeed in this, they're going to lead the transformation before the dollars start to arrive.
Absolutely. And you mentioned those, kind of number of times the ROI and kind of the core ROI rich case studies. I mean, are there any patterns that you're seeing in terms of where, whether you take patient access, you take revenue cycle, you take, patient experience, scheduling, referrals. There's a lot of places to start, right? Are there any kind of like high value, lower friction, areas that you're seeing are like good places to kind of dive in when you want to, start somewhere within, with a small project on either applying AI or automation?
Yeah, I think the areas that bring immediate ROI, high impact, definitely, there's revenue cycle, right? You've got the ability for AI to automate many of the back end and front end processes, the ability to support coding so that you can reduce denials, right? A big issue that we are now consistently dealing with is access. And with access, the ability to look at things like prior authorization, referral management, um, improving scheduling, and this is where AI can really help support and provide many of the automations, right? um, you can reduce the friction on the front end command centers, right? So I think these are pure play areas. Another area that we are starting to see um, real use case is, say, incidental findings management. Again, we have a solution partner within our Cypher Collective that supports this. This is a real problem, right? I think the data shows that if you're able to um, identify a lung cancer nodule at the early stages, you can improve 5 year survival rates by 80%. Now, from a provider perspective, many times they're so inundated with so much data that they don't have a way to really look in, despite their best intentions, to identify when there is how to prioritize an incidental finding. And from a patient perspective, they don't even know how to navigate that incidental finding and then be able to take action, right? So ultimately, I think these are all areas that we are starting to see traction. They are high value, high ROI areas. Um, and I think, that's where we're going to continue beyond just, not just, but beyond incident, beyond ambient listening,
Yeah.
which, has truly been adopted by many health systems around the country.
Fantastic. All exciting spots, I think places to start. And like you mentioned, just tremendous amount of ROI opportunity in each of those areas. All right. So the next one's kind of a two-part question. First off, for those excited about jumping in, joining, or, working with ACG on the Cypher Collective, how do they get in touch with you? What's the best way to get plugged in? And then once that happens, what should they expect as like the initial experience getting started with the collective?
Yeah, the best way to find us is on the ECG website, um, and we have a link to the Cypher Collective, and within that link, there is a description for every one of our partners, direct links to each of the partner websites. We also have a link to um, request um, for a contact, and then we can get on a call. We can demo the capabilities. We can demo the capabilities of every one of our vendor partners. We can provide more information on each of the vendor partners. We're happy to talk through the value proposition of each of the solutions that are in the collective. Uh, and I think the core um, value proposition ultimately is to help our clients really think about how do you prioritize the roadmap for AI.
Yeah. And then does that involve like a workshop where you get together and kind of help build out that roadmap as a starting point and, kind of address those areas of first to dive in?
Yeah, great question. We are um, actually speaking to a few customers right now where they have, we've had inquiries about not just Cypher Collective, but in general, where do you even go with AI, which initiatives to invest in. So yeah, we typically go through a workshop approach. We try to think through what are the organization's key strategic imperatives, the North Star, if you will, and then use that as a guiding principle to then develop that prioritized roadmap. Right? We then bring in the potential vendor solutions to the mix. So that would be the
Yeah.
way we would go about doing this.
Yeah. And I imagine that if they do have, kind of some investments and other things, those can be incorporated into the strategy. And, it really becomes a way to, kind of help turbocharge and accelerate, even if they have already started, I think, which is a pretty solid, also additional benefit of the type of approach you're taking.
Yeah, and I hope that it's not. I think the message I hope everyone takes away from this is we're not implementing technology for the sake of technology, right? We are trying to do this in a way that's going to maximize the value of the technology that is being implemented. So how do we make sure that this is being done in the optimal way? We bring in the capabilities with our consultants where we understand the operational impact of the solutions that we're bringing to the table. And then we can help navigate all of the the internal stakeholders and really think through the change management and transformation process for an optimal implementation.
So, thinking about all of that, what is your hope for, the next few years of this, right? What do you see coming, or what do you really hope happens with, the progression and kind of the launch of this initiative?
Yeah, we. I lived through the .com hype cycle. I don't think it's gonna surprise anyone that anyone who's been through any technology hype cycles before, emerging technologies, they inevitably go through this maturity, adoption, social application phases. And then starting with the technology trigger, where a potential breakthrough kicks things off, we have a lot of these early proof of concept stories, a lot of media interest that triggers significant publicity. And then we go through this peak of inflated expectations, right? This is kind of where we are today. We
Mm.
go through a trough of disillusionment. It's not, but I'm hopeful that all of this is not all doom and gloom, right? We will eventually get to a point where AI will start to become ubiquitous. It will go mainstream, and I'm not sure we'll have this, the artificial intelligence manifested holographic doctor from Star Trek Voyager, if you remember that, and within the next decade. But I'm hopeful about the adoption of AI, the benefits that AI ultimately will bring to our industry. I hope that in a few years from now, when we're having this conversation again, um, I hope health systems will consider this applicable. Right. Having said that, um, health systems, we hope will start to see the economies of scale from many of these common use cases, which hopefully will become ubiquitous. AI will start to develop to deliver measurable impact that can be tracked. We know that quantifying ROI, it's not always straightforward. There are a lot of indirect benefits. You can't always isolate the exact contribution of a technology enabler to financial gains. That can be tricky. Low adoption rates can limit success, and that's why we always have believed that evaluation of any AI or technology strategy needs to take this balanced approach, right? You got the financial metrics, the qualitative impact assessments for sustainable adoption. And I also hope that despite the rapid evolution of AI, we don't lose track of the fact that AI at its core is human. We
Mm.
talked about this earlier, and AI software alone cannot drive meaningful change. Like any other technology solution, it will require people, process, and technology to work together to drive transformation.
Amazing. Asif, it's always a pleasure to connect. Thank you so much for joining today. We couldn't be more excited to be, part of and working with you and the rest of the Cipher Collective. So it's been a real pleasure to have you today on the show.
Likewise, Rich, thank you for having me here.
Thanks again.